I'm Rachel Long, and I'm going to be performing my wound care today. I'm going to start by identifying the 12 steps, which will first be to verify your patient's order, and then you are going to perform hand hygiene before and after every procedure performed. You will, or I will, verify the policies, procedures, and gather all my equipment, and I will check the manufacturer's recommendation on this equipment. I will then knock on the door for my patient. I will use two identifiers to identify them. I will check the overall status of them, and then I will explain the procedure and provide for privacy. I will raise the bed for good body mechanics and don appropriate PPE. And after the procedure is complete, I would lower the bed and side rails per care plan and put call light within reach. And then I'm going to document all of my findings. And so I'm going to start with removing the dressing that's already on here. So I'm going to apply clean gloves to do so. When I go to remove the tape, I'm going to pull the skin back so there's less resistance, and if needed, I would moisten the tape to help remove it. And I'm going to remove this out of view of the patient so the patient doesn't want to see blood and doesn't get upset. I'm also going to pull the packing out, and I'm going to check all this and check it for the exudate, check for serious and purulent and the sanguis and the serosanguis. And I'm going to go ahead and remove this. And then I'm going to don new gloves so that I can examine the wound. And while I'm doing all this, I'm going to be asking the patient about how they feel about it. If they're in pain, I would provide medication 30 minutes prior to this change. And I would also ask if it was tender when I palpated it, and if there's, I'm checking the peri-wound skin for any abnormalities. And I'm going to check to see if there's any drains, such as like the Penrose. And I'm going to check what type of wound it is. So is it a pressure ulcer? Is it full thickness or partial thickness? Is it a surgical wound? I'm going to check the type of tissue, look for granulation, slough, eschar. And I'm also going to measure the wound. And when measuring, I'm going to use my applicators and my little handy dandy craft here. And I'm going to use whatever the previous nurse used before me, and today we're going to say that's centimeters. And I would come and hover over the wound, but not touch the wound for length, and the same for width. And then for depth, I would take my handy dandy cotton applicator, and I would go in the deepest part of the wound and slide my fingers down to the tissue, and I would measure the applicator. And when I would also, if necessary, I would check for undermining or tunneling, and I would also measure them accordingly. So now that I have assessed the wound and measured, I'm going to take off my gloves, and I'm going to open my sterile field. And before I do my sterile field, I'm going to go ahead and pull my tape apart and get it ready. And I would pull off 3 strips. For this size wound, you may need more or less depending on the wound itself. And I make sure that the tape is going to fully cover the ABD pad once it's on. I'm also going to pull off a small strip and initial date and put what time on it. That's right, time. And so I'll put that here. And set those aside so that I can have my sterile field. So starting my sterile field, I'm going to open away from me, into the sides, stay within my 1-inch border when doing so. This one already has an ABD pad to it, so I'm going to add more gauze, and I'm just going to throw it on there. And then I would do the saline, and I would check the label, that's the word, for, make sure it's not expired and it's the right solution I need to be using. So then I'm going to take the cap off and put it on there correctly, and I'm going to, once again, not go over my field, so I'm just going to gently wet the gauze I need wet on. And then we're going to set this aside, and I'm going to don my sterile gloving. But first I'm going to come with this 1-inch border and pull this over just slightly so that I have enough room to put on my gloves. And never turn my back to the field while I'm doing so. So I'm just stepping over here. I'm going to take this out of the package. And once again, I'm staying within my 1-inch border. And I'm going to start with my dominant hand. And then with this one, I'm going to pull it on. I think now that these are both sterile, I can touch the inside and fix my fingers that didn't want to go in properly. Okay, so now I'm good. And I'm going to come over here and I'm going to keep this between my shoulders and my hips for my gloves as I perform this procedure. And I'm going to start with cleaning the wound. So I'm going to, so now I have sterile fields on, I can reach across, or sterile gloves, I can reach across my sterile field. So I'm going to grab some dry gauze here and kind of come over here to clean it, and I will start with the least contaminated into the most contaminated. So the least contaminated would be the inside of the wound, and I would just swipe down. And then I would grab another piece and do as well, but I would do the outer contaminated. And one more time for the other side. And now I want to pack my wound, and with packing I'm going to be using wet gauze, and I would use one piece here, and you would try to fluff it as much as possible and get it good and pulled apart. And we're going to need a cotton tipped applicator to pack. And so with this wound, it's not really possible to fully pack it, so we'll just have to make do. In real life scenario, we're going to want to make sure this wound is fully packed, the packing's within the wound bed and not sticking over the skin. So that looks about as good as I can get it for now. So now I'm going to add 2 pieces of gauze, dry gauze over the packing. And I'm going to take the ABD pad and lay across. Now I'm going to tape each piece over. And I'm also going to add my tape that has my initials, date, and time on it. And now that I'm done, I would document my findings, of course, and I would check the patient and make sure, just do another assessment and make sure they're okay. Thank you.